Good morning, everybody. My name is Charles Aunger. I'm from Health2047. So, Health2047 is the innovation company for the American Medical Association. How many people knew we existed? That's a pretty good number. Yeah? We've been going 3 years, and we're based in Silicon Valley. I'm obviously not from Silicon Valley. And what we look at is everything to fix healthcare. We look at the new and exciting ways of how healthcare can be transformed across everything. Who has been in a situation where they've had a script written and they've gone to pick it up and they found out they've got the wrong medication? Yeah? I used to work at a very well-known medical organization and actually worked in the technology side trying to link these things together. I've worked around the world doing that, and what I find every single time is the simplest things that fail. I got diagnosed in February with HSP vasculitis, 2 in 100,000 people. And I'm on medication and life's really good. Things are great. The difference happened is this. I looked inside my platform, I saw 4 people see me, and I went to CVS to pick up my script. I shook the bag and went, interesting, and the person said to me, $24. Now, $24 doesn't sound expensive for a script, but my refills normally cost me $4. So who thought something went wrong? What went wrong was this. They'd actually prescribed me 15 times the medication that I was supposed to have. 15 times. It had bypassed 4 people and still got transmitted. And even the pharmacist turned around and said, I can't do anything about it, I've issued the drugs. I can't take it back. Would you like to keep it? Funny enough, I got a refill the next month for almost a similar amount. Pretty amazing, huh? So what we look at today across healthcare is the idea that transparency, there is a severe lack of it. Who agrees with that? It's amazing, right? So we all agree, but are we doing anything about it? So we're doing things about it. We look out there and try and figure out how to bring people together to make the difference. We had a blockchain event in Chicago last week, and we had about 150 people there from the AMA talking about blockchain. Is everybody excited about that? We've had situations where people are asking the questions and want to be involved. That's phenomenal. We look at scale and how to cost. Bespoke solutions are costing the incompatibility and incomplete nature of healthcare. So we're looking at that. How many people have heard the words consumerization in healthcare over and over and over again? Right? It's slow. And everybody is forced down the route of consumerization is going to fix healthcare. Interestingly, healthcare is not going to be fixed by consumerization. Globally, we have people at the center of delivering care. That is how healthcare and care is delivered globally, and we have physicians and people that deliver that care. And that's not going away anytime soon. And then we've got to look at infrastructure and the future planning of infrastructure. I worked in Abu Dhabi, and I spent 6 years there. We built an environment called Cleveland Clinic Abu Dhabi. My spend on technology was $1 billion. Yeah? But the first time I've ever seen this happen in the world, we went from 0 to HIMSS level 7 at day 1. There was 0 paper in the building. You cannot even order your breakfast and touching a tablet. Every single piece of equipment in that building, biomed, everything was owned by the IT department. You could integrate the window blinds into your sleep pattern, and they would adapt. Because we did it from the ground up. We rethought the infrastructure, and we planned for it. In contrast, I moved to California, and what was a $4 billion building in Abu Dhabi, 4 million square feet, turned into an 800,000 square foot building, $4 billion in California. Is there something wrong with that, everybody? A fourth of the size. And we planned for that building 10 years to get that building built in California. 10 years. So we've got to start thinking outward. Changes are happening. We know that the shift of data, everybody talks about data, right? So everywhere there's data, what we use data for is only when we understand how we use data is when you get outcomes. Having data is no use for it unless you know what you're going to use it for. Everybody knows how to use Netflix because it's a video. You press the button and you see it. You consume what's already there. But if you don't know how to consume the data, there's no value in the data. Redefining how we handle that data is going to be an interesting aspect. And blockchain gives us some abilities to understand how to use data and where that data provenance came from. It becomes fun when you talk to people about different aspects of technology and data, and then people start talking about size and scale. Well, in certain environments in healthcare, we talk about petabytes and petabytes of data. But then on the other hand, I have a person in the room that says we're going to put all the EHRs and images on a blockchain platform. Yeah? I sit there and go, I can put Bitcoin, the whole database, on a 250 gig USB stick. How are we going to put petabytes of data on a blockchain platform? And how are we going to make that work? It's kind of difficult. So what do we actually end up doing? We end up looking at three aspects in life, and that's what I've been looking at, is we change technology today, and this is how the world has been changing over the last 10 years. We have new ways of accessing technology and infrastructure. It's called cloud. And I look at people and say, if you're not moving to the cloud, and I was a very big outlier in this about 6 years ago, when I used to stand on stage and say, healthcare needs to move to cloud. I cannot afford to build the systems and manage and maintain them in my own IT team. And should I be? Should I not be looking at how I use the data instead of looking after infrastructure? Who would agree with me on that? We actually know today there's only really 4 big players in cloud infrastructure, and they're all now deciding to get into blockchain. They might be a little late, but they're all starting to get into it now. Utilizing data, everything arises around the importance of data and securing the scalable nature of that data. The problem is, what happens when the database fails? How do you back it up and restore it? We have technology today in hospitals and healthcare environments where the provenance of the data is a really big issue when the system goes down. We've seen lots of instances over the last year where IT teams have seen big EHR and EMR platforms fail and had to go back to paper. What do we do when we go back to paper? I've had instances where people turn around and say, it's okay, we're going to use an iPad. It's not that difficult if the EHR is actually down. How am I going to use the iPad? And how am I going to validate who put the data on the iPad? It's okay, we can use images of the face of what's going on. How do I know that that person really is that person? It's quite an interesting problem. The most important thing is when I've got the infrastructure and the data is how I do insights. We talk about AI a lot, and insights is really important, and how we analyze that data and use it is really important going forward. And AI is coming no matter what we do. It's in every walk of life today that we probably deal with. You bought an airline ticket to come here possibly, or got in a car, and you used AI technology. If you're using Waze, it's AI-based. If you're using Expedia to book an airline ticket, United, whoever it is, there's ticketing systems now that are AI. Real-world examples. We've been looking at blockchain for the last couple of days here. Real-world examples of where we're going. We reached out to healthcare professionals around the world and asked them where do they think things are going in the data catalyzing change. And over again, the exchange of patient information became the highest #1 priority. We all know that, right? But the most interesting thing was the second one, integrating medical devices. Integrating medical devices. I've worked with a medical device company for the last 7 years to try and get them to adopt Wi-Fi, and they still won't do it. Medical devices are very important, and the reason why they won't do it is they can't figure out if the validity of the information they're getting is coming through. Blockchain has the ability to do that and enable the technology underneath it. Making those integrations vendor neutral is also very important, that it would be agnostic across the platform. Big data is not a healthcare savior. The data around what we're looking at today is we get more and more, we get told about what is the difference about what we're doing, and let's get more. Getting more is not going to help. We've got to get better. We've got to figure out where that data came from and what we're going to use it for. So we need to be better. Collaborating on the effects, and we tweeted out last week, is the most important thing that we can do. If we do it all individually, we're not going to make the difference. And we showed at the video at the beginning, it's about collaboration and bringing that together. It's fun times. When you sit in an environment and you can actually bring people together that haven't been together before, it's phenomenal. But that's called sharing. We do that in Silicon Valley pretty well in some instances. We do greenfield. We know how to stand things up when there's a clean piece of paper. I thought I'd put that up. Everybody talked about yesterday, what standard are we going to use? So anybody got any ideas what standard we're going to use? The standards, we need an air traffic control mechanism. The CAA, the FAA, and lots of other air traffic control institutes around the world control barriers. They look at how airplanes fly in and out of their flight zone, but they collaborate. And they share data in a standard, and that makes planes fly. If the information is traveling between nodes, we need some sort of air traffic control to understand where that was going and monitor it. It's not to control whether it is there or not, but it's to give it an idea of what should be there. The mandated security permissions, again, this is not to stifle innovation or move that down, but it's to make things happen where we know there's a graphical standard to adhere to. Universal operating procedures. There are ways to communicate in airplanes with air traffic control and ground and everything else to make your life work. It's not that difficult, it just happens. Different companies and players in the system, if you look at behind the scenes, as soon as you get on a plane, there is lots of information flowing by a company called Equant, and Equant gathers hundreds and hundreds of data points globally and actually connects those together. It's what tells you that your plane just left the stand. They've been doing it since the 1970s. Why can't we get that done in healthcare? So in closing, the priorities are kind of skewed at the moment. Fixing the system is not about just making a difference and saying we can do blockchain. It's about jumping the chasm and the gap and understanding the collaborations are just as important as doing the technology. The tools are there. We can make the tools happen. And how those tools get integrated are about working with people. Whether Epic or Cerner or Allscripts is there or not there, they're not going away. We've spent billions of dollars building EHR systems, and we're spending billions of dollars more globally building more EHR systems. Right? They might be version 1, but ERP systems were version 1. We've got to be able to integrate with these technologies and add on top of those. You've got to smile whilst you're doing it. You've got to make the run and you've got to make it happen. The most important thing is being trusted and transparent about how that's happening. I think that's the transitional change about how we see infrastructure and data going forward. The passion is about seeing the opportunity and keep going, just like the Griswolds did, if everybody remembers that film. Yeah. It's about running for the finish line. It's not about starting for the first 5 meters and then falling on your face or running into the tree. Infrastructure is built together, and we're going to build it together. I hope you have a good rest of the show. Thank you very much.